Hi, my name's Louise Marriott and I'm part of a team from the University of Dundee who undertook the My Data project, which looked to understand the perceptions of administrative data usage for research of people who use drugs. So why explore the views of people who use drugs? We've got a lot of evidence that the public are mostly supportive of using administrative data within research. But we thought this group might be different, and there were a few reasons for that. One is that this is a hugely stigmatised population, and that often results in distrust of the services who are collecting the data that we're interested in. So we thought that the views might be different within this population. These data might be particularly sensitive for this group, so we're talking about sort of mental health data, drug and alcohol service data, hospital admissions and so on. So it could be particularly sensitive for this population. And there's also quite a divide between the people carrying out the research as academics and the population that we're interested in. There are particular demographics involved in this population, and we have quite high levels of illiteracy as well. So there's quite a gap there between the two groups. So this is why we're particularly interested in looking at this group's views. So we aim to explore the views of using admin data in research, which are held by people who use drugs, and we wanted to create a short film with this population to explore those views. And finally, we curated a list of people who are willing to help in future research. We did this using focus groups. Firstly, we had a partnership with Restoration 5, who were absolutely tremendous. We had 2 focus groups exploring the use of admin data in research and what people's views were. So we had 12 people in the first group and 11 people in the second. And we worked with this amazing conference illustrator, Graham Ogilvie, who drew what people were talking about, and that gave that really instant feedback. We also did other sort of creative approaches as well, including a traffic light system with different types of data, talking about how people felt about the use of those different types of data in research. And our findings were quite broad. There was a huge amount of discussion, and actually people were really interested in this topic, although that wasn't always how they felt at the beginning. They didn't know a huge amount about it, but it really prompted a lot of discussion. Generally, people started with quite a limited understanding about how their data were being used in research and the processes behind data linkage. So we talked a lot about that. And overall, people were happy to share data. For some, there was a view that some data were particularly sensitive to be shared, and that differed from person to person. We talked a lot about consent and whether data should be consented, and people were quite surprised generally that they weren't consented. And there was the challenges for us were really about disaggregating the using data for research as opposed to service use, and a lot of our conversations focused around that. We also carried out 4 creative workshops, and this worked with people to create this film based on the ideas that we'd been discussing with the larger group. There were up to 6 people in each of these workshops, and we worked with an animator, Andrew Lowe, who was fantastic as well. It was very much up to the participants what went into the film, and you can see those films if you come into one of our workshops. The feedback we got from participants about taking part was fantastic. On the involvement in PPI generally, they said it was enlightening, said it just goes to show that when you get into recovery, you can do anything you put your mind to. Said you start to get involved with groups you wouldn't normally get involved with. So they really enjoyed it and really valued the experience. And the feedback on learning about admin data and how their data were used was that a lot of us didn't realise how their information was being used when it began. And that they feel a lot more informed after participating in the workshops. They had some key messages for researchers. They're really keen to know what's happening with their data and want us to tell them. There was generally a preference for telling people face to face, although we did talk about the challenges of doing that. They wanted everyone to bring pizza. They thought that was brilliant. We bought pizza every time, and we can talk more about the funding around that because the individual level funding was tricky. There are a huge number of people involved in this. This is the participants you can see along with the team in the photo. But do come along to the talk if you want to hear more. Thanks.
Everyone, I'm Mary Wilson, a research assistant at the University of Glasgow, and I'll be providing an overview of the work carried out by the School's Health and Wellbeing Improvement Research Network, known as SHINE, to engage with school communities across Scotland on the potential of introducing data linkage to the SHINE Pupil Mental Health Survey. The RDS Public Engagement Fund allowed us to consult with pupils, parents and teachers around data linkage and create a video and infographic explaining the process and benefit of data linkage in an accessible manner. SHINE is led by researchers at the University of Glasgow and is a network of 765 schools across Scotland, which aims to transform health and wellbeing outcomes for young people through high quality school-based health research and an accessible data infrastructure. Schools who are members of SHINE are offered the opportunity to complete the SHINE Pupil Mental Health Survey and receive a PDF report showing aggregated school level results with national comparisons from the Health Behaviour in School-Aged Children survey. This provides a picture of the mental health of students within the school and also across SHINE schools as well. As a future development, SHINE hopes to enhance the school research collaboration by asking students for personal identifiers such as name, age, postcode, date of birth or Scottish candidate number in the mental health survey alongside consent for data linkage. SHINE already collects date of birth and postcode in the survey for demographic data, but collecting sufficient personal identifiers and the associated consent would then permit an application to link the data to other sources in Scotland and in the UK, such as health and education data. This would allow for factors or associations to be identified that would otherwise be difficult to determine, which could result in more data-informed policy making and provision planning. There have been some concerns within the school community around collecting personal identifiers or personal information from young people and around data protection issues. Therefore, SHINE decided to gather qualitative feedback from member schools on the potential of collecting personal identifiers and consent for data linkage, and also to understand which identifiers are the most acceptable within the school community, with the aim of co-creating relevant resources which would allow parents and pupils to make an informed decision about providing this kind of information. SHINE worked with DataMind, the MRC-funded hub for mental health research development, to explore the feasibility and acceptability of collecting personal identifiers for data linkage as part of the SHINE Pupil Mental Health Survey. Qualitative data was gathered from school communities between April and June 2023. We conducted 8 face-to-face focus groups with pupils, so that was 64 pupils in total, 3 online focus groups with teachers, 7 in total, and 1 online focus group with parents and carers, and that was 14 in total, from 6 local authorities. The focus groups were shown the SHINE survey and spent some time looking at the PDF report before being introduced to the process and benefits of data linkage. The group then provided their views on the feasibility and acceptability of data linkage, becoming a feature of the SHINE survey, and brainstormed for us some ideas around the design and the content of resources for the whole school community to facilitate this potential process. So here they are. So the RDS Public Engagement Fund allowed the team to travel to schools across local authorities and create a video and infographic using feedback gathered at the focus groups. The communications manager at the schools, the Social and Public Health Sciences Unit, Eddie Miller, supported the creation of these resources. SHINE plans to disseminate these resources in stages, embedded in context of established school research partnerships in order to facilitate future implementation. But the project is still in an exploratory phase. An article in the SHINE newsletter reflecting on this showcase event with a link to the video, a blog post on the SHINE website expanding on the project and providing context on the potential for data linkage, a webinar on the potential of data linkage focusing on attendance and mental well-being, and a workshop for teachers at the SHINE National Network Conference are just some of the initial dissemination activities that we're planning. So if you'd like to view the video or if you have any questions about this project, we'll be showing the video and answering any questions in our breakout room shortly. Lastly, just to say thank you very much to the Shine team and also to Research Data Scotland for allowing us to create these resources and to present here today. Thank you.
Hello, everyone. My name is Maria Jose Pavez. I'm Grampian Regional Equality Council's Co-General Manager and Policy Officer.
Hi, I'm Michelle Haywood. I'm a development worker at GRAC.
So we are sharing today our summary of the How Fair is North East Scotland research project on public engagement and research in North East Scotland and the perspectives from ethnic minority communities. So we conducted these workshops during 2023 with ethnic minority communities, specifically in Aberdeen. And we aim to explore participants' ideas about research and consider how communities could be actively involved in building evidence about inequalities in North East Scotland. We delivered 6 workshops with a total of 40 participants, 15 men and 25 women, and ranging in age from their 20s to their 60s. We had people from diverse ethnic and national backgrounds, and everyone was invited to discuss what research is, what topics they would like to see more research on, and how they would like to get involved in research processes, and also in how to get involved in influencing changes to policies. Broadly speaking, participants define research as a tool for gathering information to understand a topic or to find answers to a question, and most felt that research should solve problems or improve people's lives. Many participants were enthusiastic about getting involved in research, especially in lived experience groups, to help bring knowledge from their own lives and communities into research and policy.
So there were a number of key themes that arose from the different focus groups. The main theme, and the one that kind of underlied the rest of the project, was information and support for newcomers. A lot of the problems that people have arise from not having good access to information, not knowing where to find things, where to get things. And participants were really concerned about improving access to reliable information, especially on things like everyday needs. Where do you buy certain things? Where do you get certain things? Health, rules and responsibilities, expectations, unspoken rules, people's rights at work or as tenants, entitlements to benefits and other support, and also how to report problems and to find help. So other topics that kind of fell under that to a greater or lesser extent included employment. So there was a big issue around underemployment among skilled immigrants, barriers to employment, prejudice in the workplace. Racism was a big issue, unequal treatment. So a better understanding of how and why people are treated differently, consciously or unconsciously, and identifying strategies to reduce racism. Integration, culture shock, and mental health was another one, to help people understand people's experiences and identify ways to make things easier for people, including how to get involved in community life. People were very concerned about their children and their experiences at school, so understanding people's experiences, where conflicts and misunderstandings arise, again, often under unspoken rules around discipline, behavior, expectations, and developing strategies to help navigate these issues more effectively and support families and young people and teachers and schools to sort of mutually understand each other. Healthcare was a big issue, including experiences with the NHS and barriers to accessing healthcare. And people were wanting to tell stories about the adverse outcomes that came from difficulties in accessing healthcare. So those were the key issues that we found.
And in terms of recommendations, we clearly identified a clear appetite for involvement in research and lived experience groups. So we recommend exploring how this might look like for the public, but also for third sector organizations, and how evidence from these groups can help shape policy. By amplifying the voices of seldom heard communities, lived experience groups can contribute to research and to help build a body of evidence that supports the decision-making processes. As co-produced spaces, they offer a more sustainable engagement model whilst building capacity at the grassroots level. So this is something we will definitely be looking into as GREC, and we'll recommend our local partner organizations to do that as well and work collaboratively to do so. Thank you very much.
My name is Iona Benge. I am a Knowledge Exchange and Impact Officer, working with mental health data scientists at the University of Edinburgh. This Mental Health Imagining Beyond project was done in collaboration with the Community Wellbeing Collective, who are based in Wester Hailes in Edinburgh. Wester Hailes is a working class area of disproportionate poverty, and the group we worked with included members from a variety of ethnic and cultural backgrounds. So we took quite a bit of time at the start of this project to build trust between the data scientists and the CWC members. We wanted to establish an atmosphere of genuine cooperation. Through these discussions, we created 2 resources. The first is a very practical list of needs, covering things such as providing childcare, paying people for their time, and planning in breaks. The second is about creating emotional safety within our working group and also when working with the wider public at events. At the first workshop, we asked some questions to get a baseline for our evaluation. However, these turned into deep insights in and of themselves. You can read the edited transcripts on our blog. They were edited by the participants themselves, who removed any information that they didn't feel comfortable sharing publicly. In this quote, the participant describes the long depression screening questionnaires that they were asked to complete over and over again. They remarked that this wasn't a healing way of sharing, and it didn't communicate their struggles and joys. If that's the way you're collecting data, I don't trust what you're doing with that data, because I'm like, that's bad data. It doesn't capture anything for me. At our Demystifying Healthcare event, our researchers were challenged to describe the data journey from GP to researcher without the use of technology. This resulted in the creation of foldable leaflets, posters, and a miniature book, which you can view and download from our blog. Our participants also created their own data islands to describe how health data should be handled and shared. When describing their island, this author said, "I do not fear my data being shared. I fear wrong judgment being made by officials with my data, as they may come to the wrong conclusions." We also facilitated some CWC members to conduct their own mini-investigations. Of particular note was a project on the causes of stress and how people deal with it. These inputs have now been included in a Wellcome Trust data science application, and we are looking to find other ways to keep these individuals connected to this research. And to share more informally about the whole RDS-funded project, the CWC is currently compiling a zine. And I'd like to finish today with 2 challenges that the group posed to us during this project. As we spoke about recruitment to research studies and cohorts such as Generation Scotland, no one in the room had ever heard about such things. One person asked the pertinent question, "Where was I when that question was asked?" A second challenge was around our data collection techniques. Within the CWC, sharing personal stories was felt to be a very healing process. So how could we alter our processes so that research data collection is more gentle and potentially even healing for the individuals involved? Thank you for listening, and a huge thanks to all the members of the CWC and the Division of Psychiatry who took part in this project.
Hi there, my name is Kimberly and I work for an organisation called People Know How. People Know How is a Scottish charity that aims to improve wellbeing across communities by supporting people to overcome barriers and thrive. We deliver services locally in Edinburgh and the Lothians and engage in research and campaigning to affect change on a national scale. We also provide a national support helpline. Our work supports all parts of the community, including children, young people, families, and adults. So today I'm going to speak a little bit of the work by ourselves in partnership with the Binks Hub and Research Data Scotland. Firstly, I'll tell you a little bit more about the Reconnect service. I manage the Reconnect service, I'm the service manager. So Reconnect offers supports to adults and families in Edinburgh and the Lothians to help them improve wellbeing by increasing digital and social inclusion. We believe that digital and social inclusion are linked together and contribute to enhanced wellbeing. We provide a supportive environment to reduce social isolation through building digital skills and maintaining connections, helping people to stay connected, improve financial health, increase employability, and access to resources and more. At People Know How, we use research to link academic literature with our own findings from consultations and action in the community. Articles are often written by our volunteers and staff, and these really offer a unique opportunity as part of their time with us. People Know How's research articles also create an evidence base for our work by integrating the findings from prior research to our projects, forming a database of resources, important findings, useful ideas that is available to all of the third sector, establish partnerships between People Know How and other organisations across the 4 sectors, and spread awareness of our work. People Know How with the Binks Hub, Edinburgh, Good Things Foundation and Research Scotland carried out research by training citizen researchers to help People Know How have a unique insight into the Reconnect service and to find ways to improve the service and to develop the service further. What we did is we held 3 workshops, and the first 2 workshops were really focused on what is required to conduct good research, brainstorming ideas to draw out through the discussion, looking at ethics, informed consent, ensuring there's no harm to participants, making sure everybody was aware of confidentiality and data protection. We also look at how that data was collected, for example, using dictaphones, transcribing the interviews, how people could use the dictaphones safely and to ensure that there was no data being leaked. The next session was similar layout, but we ran mock interviews and mock focus groups, and we allowed all the participants to really have practice, have an opportunity to practice what they were doing. And the third session was really looking at analysis, should participants want to be involved, keeping data safe as well. Now, the results of the research kind of highlighted a few themes that we knew that were going to arise, and some that we didn't know so much. So we knew that one of the factors that kind of stopped people from using digital was fear. For example, I was fearful of the whole rigmarole around computers, printers and paper. I was held back. I couldn't afford it. At community education classes, they were offered people were offered a free iPad, and nearly all of them refused. I couldn't believe it. Another theme that had come up that we did realise it was important was the importance of the service that we provide, and how it was person-centred. So helping people holistically, it is essential, and we recognise that because all individuals that we support are complex beings with different physical, mental, emotional and social needs. So we want to ensure that we can echo that language throughout policy, ensuring that we are using the person-centred approach at all times. One of the quotations that I have here from the research is, if I were to add something else, it would be something like, it's supportive for where you are as an individual. Another theme that had come up was the theme of independence and increased self-esteem, and how the groups themselves actually combat social isolation. One of the things that we do need to work on is the fact that people had different views of what the Reconnect service is. So there is some work to be done here. So moving on, we really want to find a way that people won't feel alone in the fears that they've experienced. So we may look at ways to express that in marketing, for example, testimonials, using the person-centered language, in formal and internal texts and training. Also having a look at how we evaluate where people are at each of the groups that we run, and working on changing to internal policies and practices. Overall, we got a vast amount of information from the research, and it's really, really useful, and we have a lot of ideas on how we can develop this further. And that's all. If you have any other questions, please do get in touch. Thank you.
Hello, I'm Maria Fanougiaki, the Public Engagement Officer at the School of Biological Sciences at the University of Edinburgh. Our project, Data in Biological Research, Infectious Diseases and Minecraft, is a project that was run by a big team. I'll let the others introduce themselves.
Hi, I'm Perrin Grant. I'm an infectious disease modeller.
Hi, I'm Kate Duggan, and I'm a PhD student working on virus evolution at the University of Edinburgh.
Hi, I'm Janet Patterson. I'm Public Engagement Manager, School of Biology, University of Edinburgh.
Richard and Daniel aren't here at the time of this recording. So we partnered up with Science Skills Academy and worked closely with Emma Plato, the STEM engagement manager there. This funding opportunity helped us create a new game-based workshop to engage teenagers and young adults with data in public health research. It also helped us create a new partnership and reach young communities in the Highlands that we don't often get the chance to reach. We engaged young people with infectious disease and modeling in biology by using the popular video game Minecraft. I'll let Perrin tell you more about this.
I built the game to engage children and teens in collecting disease data related to geography. The game was based off my senior honours project model, which you can see on the right, and Minecraft was chosen because it's really good for children and teens as they're very familiar with the controls, and also as the game is very customizable, making it easy to code in these sorts of workshops to it. The game was set in Scotland with 5 mini-cities, each with a different disease for participants to explore and compare the differences between. And this allowed them to engage with familiar locations and clearly see the links between the game and real life.
So each of these different scenarios was based on a different real-life virus variant, each with different characteristics and affecting different people. So the work we do in our lab requires quite a lot of data, both from the virus and from the host. But what's generally poorly understood is how that data is collected and what people do with that data. So we've all been the source of that data throughout the pandemic. When people go and get swabbed and get tested, that data then gets analysed. And by designing these little Minecraft scenarios, participants were able to gather the data in real time themselves, analyze it, and then begin to ask questions about new variants, about who the virus is infecting and who it might infect next. So by using Minecraft, we were able to have really interesting and insightful conversations about the data we use.
The first delivery phase of the project was with senior secondary school pupils, and we ran several workshops in schools in Fife and on campus in Edinburgh. And that allowed us really to test everything initially, to see how the pupils interacted with the game, to see if the game worked, to test the timings and the format and all of that. And of course, to get feedback from pupils and teachers. You can see a couple of quotes there. We were pleased to hear that teachers thought that pupils who didn't normally engage in class were engaged with this particular workshop and this method. And so that feedback allowed us to refine things for our next phases of the project.
We then took the workshop up north, and with Science Skills Academy, we ran 2 community workshops and tested the drop-in format at Belladrum Tartan Heart Music Festival. We engaged with many people and we had very positive interactions and interesting discussions. This experience helped us build trust and create a mutually beneficial relationship with Science Skills Academy. Overall, we met our intended outcomes and achieved more than initially anticipated. We tested different formats of this new video game across a range of different audiences, and we got a good idea of what works well. We encourage conversations about data in public health research and reach communities we don't often reach. At the same time, we built a strong new relationship with our community partner that we aim to sustain. In fact, we are already working with Science Skills Academy on another project. In addition, we have already taken the workshop to a local youth group and plan to take it out to more and support the skills development youth work. To find out more, please join our breakout room, and if you have any other question or if you want us to take the workshop to your communities, please get in touch. Thank you.
I'm Rosie Seaman, and I received the Public Engagement Award while I was a researcher at the University of Glasgow. The University of Glasgow is committed to making a difference beyond academia and has wide-ranging collaborations with external partners to deliver societal impacts locally, nationally, and globally, and public engagement is at the centre of all of this. All of my research has been motivated by two things: big data and collaborations for public good. The catalyst for the Public Engagement Award was a research project that I had recently completed that had both big data and public good in abundance. For the research project, we had been given permission to look at data for all women who had given birth in Scotland since 1981, any hospital admissions, any psychiatric admissions, and any prescriptions they had as well. This allowed us to look at trends in different mental health experiences before, during, and after pregnancy. We could look at very rare mental health experiences, such as perinatal psychosis, and more common mental health experiences, such as the graph shows here, and that's prescriptions for anti-anxiety medicine. However, there was a collaborative part of this project that was perhaps even more powerful than the 75 million rows of data. During the project, we'd brought together over 20 collaborators with professional or lived experience of perinatal mental health. It was the stories that everyone shared that brought true meaning to the data. Data's never just numbers, it's people, stories, and real experiences. And I wanted to use the Public Engagement Award to spread that sentiment. So with the Public Engagement Award, I wanted to work with animators to try and spread that message. I wanted the public to know that when we use data for public good, we can capture stories that matter and that those stories can lead to change. With the Public Engagements Fund, myself and some colleagues from the University of Glasgow, along with the Mental Health Foundation, worked to create an animation. The artistic process of creating an animation was really fascinating, and each time we worked with Media Co-op, they brought our conversations to life in every small and subtle detail. But it was also hugely challenging to capture this intended sentiment and create an animation that could be both factual and engaging. We were then lucky enough to have the opportunity to showcase the animation at the Scottish Mental Health Arts Festival. Our animation was screened alongside a dramatisation and a documentary on parental mental health. And this opportunity was only possible because we'd worked so closely in collaboration with the Mental Health Foundation. And the Mental Health Foundation were really instrumental in widening the scope of public engagement for the animation. So they had really great contacts with local community groups and local charities in this parental mental health space. So I'd really just like to end this video by saying a huge thanks to everyone who worked on this project, and a big thank you to Research Data Scotland for funding the work.
Hi, I'm Sarah Robertson and I'm a Youth Engagement Lead at Generation Scotland. Firstly, we would like to say a massive thank you to Research Data Scotland for providing us with funding to improve our engagement in 2023 and also for inviting us along to speak today. So a little bit about a background about Generation Scotland. So we are the largest family health study in Scotland. We started in 2006 and since then recruited 24,000 volunteers across Scotland. We combine questionnaires, health records, genetic information from saliva samples, and this allows us then to build up a better picture about health over time and also maybe different conditions that run in families and how we can prevent conditions and also treat things better. Research areas include mental health, cancer, diabetes, asthma. COVID-19, chronic pain, heart disease and dementia. And what we were finding was until recently, the majority of our volunteers were over 60 years old and had maybe been involved in other health research, or maybe were part of the university as well. So we wanted to try and find a way to work with members of community that wouldn't normally engage in health research. And until just the last kind of couple of years, we've been able to include young people within our studies. So prior to that, it was only over 18s that could join. So in 2020, the team at Generation Scotland started to explore how they could include young people in health research. They worked with 283 schools across 32 local authorities and developed the Teen COVID Life Survey, which built up a better picture about young people's lives and the importance of why we need to include young people in health research at a younger age. So why do we need to include young people? So one of the points is that they're underrepresented in research, and often research that's taken place about them doesn't always involve them, and it isn't always actually relevant to them as well. So we wanted to make sure that we were giving them a voice in research that affects them, and also that we recognise their input in meaningful ways, which is where myself and my role comes in with the youth engagement side. So where we are now, so Generation Scotland received funding to try and include an extra 20,000 people in the project. We're nearly halfway there in terms of the numbers, but we still only have 1.5% who are under the age of 18. So we're still trying to look at ways that we can reach those audiences. We've also been working quite closely with young people over the last year as well to change kind of our processes, our sign-up processes, and the funding from Research Data Scotland allowed us to meet with young people and to actually remove some of those barriers so that young people can actually now independently join. Previously, their parent or guardian had to join first, so we've kind of really improved and changed that way. Volunteers can also now join online, so they can join from the comforts of their own homes, but we do still have gaps in terms of kind of sort of our membership from rural communities, our qualities groups, and also young people. So that's really where the Research Data Scotland Fund came in and really helped us to improve how we reach out to these different communities as well, because we weren't going to get that just when we were sitting within the university. We had to make sure we were trying to go out and meet with people. So the overall aims of the fund that we had applied for was what we wanted was to promote the understanding of the use of different types of data and research to a younger audience, and also engage with communities who are not often approached for different research. We wanted to also help people to understand the importance of following health and well-being over time, and also the value of why we need to start at a younger age. We wanted to make sure as well that we were allowing the public a space to inform research moving forward. So the funding allowed us to attend different events and go to where the public were at. So we attended Edinburgh Science Festival for 4 days. We went to Glasgow Science Festival. We had a place at the Royal Highland Show as part of the Change Mental Health stall, which is part of the Rural Mental Health Forum, who kindly invited us to join them. We delivered a webinar at the Rural Mental Health Forum on youth engagement and meaningful youth engagement. We had a stall at Intergenerational Gathering in East Lothian for young people, and also for young people that were care experienced. We had mental health, illness and trauma. We had a presence at Edinburgh University Doors Open Day, and the funding also allowed us to purchase equipment that would increase interaction and encourage engagement in different ways. So while people were maybe doing different arts and crafts activities, we were then having a conversation with them at the same time about what it is that Generation Scotland does, and kind of sort of trying to answer their questions along the way. So we had different arts activities. We had kind of sort of sock challenges as well, where people had to pin socks on washing lines to look at kind of different interactions and looking at kind of sort of speeds and reactionary speeds. We also had kind of different brain hats that people could create, DNA jewellery, and also we had kind of 3D brains as well that people could kind of pick up and look at. The funding allowed us various kind of different outcomes and impacts, and some of them we hadn't actually expected as well, which was quite nice, you know. So we we were able to engage with new audiences, particularly young people. We also increased awareness of health research within communities, but there were other outcomes that we hadn't expected. So staff had also gained experiences in a range of public engagement settings and partnership work, and we were still quite a new team. There's quite a lot of new team members within Generation Scotland, so it allowed them the opportunity to work together more collaboratively. Participants reported attitudinal change, that they have a better understanding of health research and the importance of joining studies like ours, and we were able to remove barriers and change kind of our processes as well. So as well as the sign-up process, we improved our websites. We also created Instagram and TikTok accounts as well, and we've been working with young people as well to kind of sort of shape those changes. The funding has allowed us to be more creative with our resources and the way that we engage with communities, and it's quite small here, but there's a wee kind of sort of snapshot of kind of a word cloud that was done at Doors Open Day as well. So what difference people's found or what their learning was at the different events. And it's always important to hear some of the feedback from people that maybe attended some of the activities. So some quotes here. So I never knew research affected us all in such a positive way, and that it can be exciting and fun too. I totally think about research differently now, and that was a young person. I thought it would be boring, but I've had fun and I want to know more about brains. And the last one I really like was I didn't realise that my brain was so wonderful, which is a young person, aged 12. And let's hope that it might actually be inspiring them to look into kind of different careers and research, as well as maybe joining as a participant. So we'd like to say a thank you to the following people. So Research Data Scotland, colleagues from across the University of Edinburgh within the different teams, Glasgow Science Festival team, Change Mental Health, the Rural Mental Health Forum, LGBT Youth Scotland as well, who kindly promoted our events on their Discord channels, and different kind of youth work partners as well, and East Lothian Intergenerational Gathering, the team there. And thank you so much for listening, and please do reach out if you have any questions. The email address is at the bottom there, and there's a QR code that takes you straight to our page. We'd love to hear from you. Thank you.